And welcome back to the Ask Lawyer Tyson show. I'm Tyson Mutrux, and today I am joined with Dr. Kyle Longo. He's a chiropractor with Empower Health. Hey, Kyle, how are you doing?
I'm doing great. How are you?
I am doing fantastic. So, tell the people about yourself, who you are, what you do, and why you do it.
All right. Well, as you said, I'm a chiropractor. I'm in St. Louis, Missouri, and I've been a chiropractor for over 15 years now. Time flies. Can't believe it's been that long. A lot of my practice has been devoted to traumatic injury, which I think is what we're going to be talking about tonight. And those are patients that I really like to treat because they can be hurt severely and they need a lot of different eyes to see them. It's not just me, but those types of cases allow me to coordinate and talk with and be part of the medical community at large. And so it's a lot of fun to watch somebody not to watch somebody be injured. I don't get to see it, but to see someone come in and they're not in a great place and then watch the evolution as they get better and better and better and get their life back. It's very rewarding.
Yeah, that's a perfect teaser into what we're going to talk about. We're gonna get to that in a little bit. Before I get to that, though, whenever someone thinks of a chiropractor, right? You normally think, neck, back. I go get the term I hate, which I'm sure you probably hate too, is get your back cracked. That's kind of what people think. But what are the typical treatments that you treat people for?
Well, my clinic sees a little bit of everything. I just talked about traumatic injury, but in truth, if you have a chiropractic sign up, you're going to get people that have minor injuries, sports types injuries, sprains, strains, weekend warrior type stuff. You got guys that just have rough jobs and, they beat themselves up doing construction work, contracting work, and they get sore. Just getting adjusted now and then helps. So I offer adjustments. We do physical rehab, physical therapy, essentially for spine as well. I've got different modalities. Two of the most exciting are laser therapy, which is very modern, and it's fantastic for not only helping to get people out of pain very quickly, but also to help the tissues to actually heal. So when there is damaged tissue, which there almost always is with injury, we actually help that to heal. It's phenomenal. And spinal decompression for disc injury. So disc herniations, disc bulges. We do non-invasive, non-surgical spinal decompression with the hopes to keep people from ever having to need surgery, and most of the time successful with that.
What are the biggest objections that you see to chiropractic care? Because we do get them from clients every once in a while, and I've got some pretty good responses. But what are some of the objections that you see?
It's mainly fear of the unknown, or they heard a story from someone. Like you said, people say they want to get their back cracked. Well, a lot of people don't want to get their back cracked. And they think that's the only thing that a chiropractic office has to offer. And so if you're going to go in there and crack their bones, they don't want any part of it. And so that is the biggest issue that I've seen over the course of my career. Some other times I've people come in and say, well, if you start, you have to go forever. You're not going to get fixed. It's just, and you just have to deal with that because there's very little truth to most of the objections or fears people have before they start care.
Yeah, one of the questions that I heard whenever I was even young, it says, and hey Joey, we got people watching on Facebook, so hey Joey, I always heard that you gotta do it forever, right? So I guess that's not true, right? Or is it true?
It's both. It's both true and not true. It depends what you're coming in for. So we talked about maybe there's somebody got into a crash and you're representing, or it's a guy that got hurt playing soccer, or someone works today in today's world. People work at desks constantly. So we're sitting, flexed over a computer, kind of slouched, terrible posture, and that has consequences. And those are types of injuries where you were healthy and then something happened where normally you can't fix it and you can get back to normal. And so there's a course of treatment and then you're discharged. But then there's a different type of patient as well. And that is a patient that usually they're older, not to stereotype, but usually it's someone that's older that has a good amount of advanced degenerative disease. And there really is no cure for that. It doesn't matter if you're going to me as a chiropractor or if you're going to any sort of medical, the ortho or the pain doc. It doesn't matter. No one is curing widespread arthritis, right? And so those discussions then are centered around management. Like, hey, you have this condition. It's permanent. Your spine's never going to be great. But here are your options. We can manage it naturally, and you come in, you see me periodically to keep moving and feeling okay. Or you take injections or take pills your whole life, and you don't want that, right? And the last thing people want is to go under the scalpel. So there are cases where you have to manage, but most cases you're talking about trying to fix something.
Absolutely. All right, so let's get into I've got a couple questions, and I don't want to get into the meat of it yet. But the one of them
Mhm.
is that we kind of talked about objections, but when it comes to bigger injuries, why do you think? And I mean more serious injuries. A lot of times you get people that are in a car crash that broken bones of some sort, and they've also got something going on with their neck or their back. Why should people not be afraid to come to a chiropractor whenever they have more serious injuries that are also wrapped into their injuries that you might treat them for?
Yeah. So when you get into, in this example you've used, like a crash and someone has a serious injury, or maybe they don't know that they have a serious injury, they just know that they have serious pain. And sometimes serious pain isn't a serious injury. It hurts, quite, not to discount the pain, but the underlying issue might not be all that serious from a medical standpoint, from a diagnostic standpoint. It might be something that hurts a lot now, but it's going to go away quickly. Or it might be something that's very severe. But a chiropractor isn't just going to have you walk in the door and you say, hey, my back really hurts. I was just in this crash, or I just fell downstairs, whatever it is. And we say, all right, well, lay down on your table and wham, bam, bop, crack, snap, how's that feel? You get better, because that's dangerous. So the first thing a chiropractor is required to do, taught to do, but also required to do is an exam to determine what's wrong. So it's that step of figuring things out first. And maybe you're not even a treatment for chiropractic, but going to the chiropractor can get you on the proper road, the proper path to recovery. And it's easy access, because if you wanted that same exam or diagnosis to happen at, say, an ortho office, you might have to wait 2 months. But who wants to wait 2 months if you're in serious pain and laying on a bed? Whereas I can see you quickly.
Tell me about a little bit about imaging. How do you use imaging when it comes to your practice?
I use it all the time. I can't imagine having an injured patient come in and not imaging them. If a traumatic injury happens, whether it's a horrific type injury or even a minor trauma, there's plenty of data that says changes to the spine are going to happen. Don't know what it is, all right? There's obviously, you could fracture something, but you could tear something, you get a disc injury. And imaging is objective so that we can actually see what has changed. Not only what the pathology might be, but then also your mechanics. How are things moving and how are things aligned? So you've got a roadmap as to where you should treat and what needs to be treated. Or just as importantly, what should you not be treating? What is not something that belongs in a chiropractic office? So you have to see what you're dealing with.
Absolutely. So I just posted a link on Facebook. So if anybody wants to come on live to ask your questions, go ahead and feel free to do that. You can also text us at 314-668-2001. That's 314-668-2001 to ask the questions. Or if you want to do it live, go ahead and click the link and I will bring you on live. So what are some of the things that are not typical, right? We talked about the typical things that you treat people for, but what are some things that what people wouldn't normally think about?
What people normally wouldn't think about. Well, you talk about back pain and neck pain. One of the misconceptions with headaches or migraines is that chiropractic shouldn't be treating those. And it was pretty exciting. Just, I'm going to say a month ago. I forget, time flies. Maybe it was 2 months ago. But finally, there are diagnosis codes for what's called cervicogenic headaches, which are headaches that come from your neck. And anyone involved in medicine has been aware of neck-derived headaches for a long, long, long time. They're very common. They're one of the most common types of headaches that exist. But there was never a formal diagnosis for it. And so it was always very frustrating for everyone involved. And I don't think the general public really understood that as well, that chronic ongoing headaches very, very frequently come from the neck. And those headaches can develop into migraines and other types of headaches as well that people associate with going to a neurologist and, are having blood flow tests done and all sorts of advanced testing, where often it's just something being irritated in your neck. And so that's something we see a lot of. Disc injury, oftentimes people think that means surgery, disc herniation, but it doesn't. Most disc injuries, they're severe, it's a major issue, but they don't require surgery if you're able to treat it appropriately, especially with decompression. And so outside of back pain, neck pain, those are two common things. But children with asthma, allergies, it's fun to treat little babies. I had it's just kind of a pro bono case. It was my daughter's daycare teacher, and she just had a new baby, and the baby couldn't turn its head to the right. Everything was just turned straight and left. And then the baby was, I think it was about 2 years old when I saw it. And in those, or 2 months old when I saw it. And in those 2 months, the baby had never once looked to the right, ever. And the pediatrician, they didn't know what to do. And eventually, the pediatrician said, listen, if he's truly never turned his head that way, try a chiropractor. And I've got a pediatric certification. So she came in, and little babies, little kids heal so fast. They don't have, long-standing bad posture. They don't have a lifetime of injuries adding up. And so they respond so quickly. In 2 sessions, in a week, and the baby was moving his head all over the place, sleeping in different positions. It was just like, boom. And so pediatric care can be really fun and very rewarding.
So I actually didn't know that. So you have to have a separate certification for pediatric care?
You don't have to. I advise it just to, get deeper knowledge and more practice with it. But no, you don't. The license is, with chiropractors, I call it almost primary spine care, where like your PCP can see any age group, but yet there are specialties in pediatrics or geriatrics in medicine, and the same thing's true in chiropractic.
That makes sense. That makes a lot of sense. You'd mentioned the codes. I know why they're important. They're extremely important for what I do, but why are the codes important?
Well, the codes are important for the people reading the charts and paying the bills. So codes, diagnosis codes. There's treatment codes as well. We were talking diagnosis codes. And there is like a number, right? A number or a code that is associated with almost, not every, but almost every injury or problem you could think about having in your body. And so it's insurance language, if you will, where I might say to you, oh, your headaches are coming from your neck. Then the doctor speak for that is cervicogenic headache. And the insurance speak for that is just a series of numbers. And so to convey to the insurance that you have headaches coming from your neck, I'll write down a series of numbers. So it's it is code.
Yeah. So if you have an injury case and you don't have that code, you don't get paid as much. That's at least in the eyes of the insurance company. Yeah.
Yeah, because insurance company, exactly. Because we're dealing with, half the time, we're not even dealing with people. We're dealing with a computer on the other side that's scanning the notes for those codes. So you got to have the right code. Then you got to have the right treatment code that matches that code. Because if the treatment code doesn't jive, it doesn't make sense with the diagnosis code, then that's an issue also.
Absolutely. All right, so let's get into the meat of what we're going to talk about, and that's just why you might want to go to a chiropractor for a more serious injury. And you and I were kind of chatting before. I love chiropractors for the sole fact. There's a lot of other reasons, but the main fact, I guess, is that they do a really good job of quarterbacking the care. So will you talk a little bit about that and why someone might want to come to a chiropractor whenever they have a very serious injury?
Yeah, you said quarterbacking the care. I think that's a great analogy to use. Case management is the term. I call it primary spine care because everyone is familiar with their primary care physician, their PCP. And the PCP in the medical world quarterbacks everything, right? They might not be treating your diabetes if it's severe. They might be sending you to an endocrinologist, but it's your PCP that gets you in to see that endocrinologist. They might not do your knee surgery, but they recommended the orthopedist who's going to do the knee surgery, right? And so chiropractors for the spine can be that person. And not just the spine, really musculoskeletal injuries, where you come in and you see us and we start with the evaluation, and we're highly trained to do evaluations. I've taken, I couldn't even tell you how many postgraduate hours in primary spine care and interdisciplinary care to be able to do an evaluation to say, all right, here's what's wrong. And because this is what's wrong, you need XYZ treatment. In my office, we'll do X. And you need to go see this type of doctor for Y, and you need to see this type of doctor for Z. And so we can put it all together and get you quickly into those other offices so that the patient is getting the best of everything, the best chiropractic treatment, natural treatment, if you will, but then also the best that medicine has to offer. I think that's key with serious injuries. There are a lot of studies that have been published that say there's really not even any controversy surrounding what I'm about to say anymore. Interdisciplinary care or multi-specialty care yields the best outcome. So if you're just seeing a chiropractor, or you're just seeing a pain doc, or you're just seeing an ortho, you're going to get limited results. Whereas if you're seeing all three and having them each do what they're best at, your outcome's going to be much better.
Yeah, the way I always put it is, if you're a hammer, everything is a nail to you,
Yeah,
right?
yeah.
So yeah, but you got to find somebody that's gonna be willing to get you to the right people. And the next thing I want to talk about is finding someone that's going to do that, right? Because what I have seen is and it doesn't matter what the specialty is, whether it's chiropractor, ortho, you name it.
Mhm.
You see that some people like to hold on to the patient, and it's no matter what the question, the answer is always money, and a lot of it comes down to money. They want to hold on to the patient and and treat them the longest, and then maybe refer them out or not refer them at all. So we talk about the importance of referring a patient whenever to someone else, to another specialty, once they've exceeded your capabilities.
So you're right. I've experienced chiropractors, I know plenty, that don't refer out as often or in as timely a fashion as they should. And like you said, I know plenty of medical doctors that do the same thing. And it's funny, sometimes in the chiropractic world, it's because they want to hold on because they're afraid if they send them to a physiatrist or a sports med guy that they might never see the patient back. That sports med guy is just going to keep them, say you don't need that chiropractic anymore, or hey, do PT instead of chiropractic, something like that. Whereas with the medical specialist, I'll see it a lot of times where they just have no interest in being the quarterback on the case and doing the primary spine care work, where they're having to piece everything together. Because primary spine care is looking at all different facets of the injury, all different facets of the patient, getting them the best for everything. Whereas a surgeon, like you said, a hammer sees nails. Many surgeons evaluate from the perspective of, does this person need a surgery? No? Okay, you don't need surgery. See you later. And then they're just out of that surgeon's office. But the patient's like, yeah, but I still hurt. Help me out here, man. What do I need? But the surgeon doesn't make, you said money, the surgeon doesn't make the money doing office visits. The surgeon needs to be in the surgical room. So he doesn't want someone coming back over and over knowing that they don't have a surgical injury. He wants them out of their office. So it kind of comes back to full circle. That's why an office like mine is ideally suited to be the initial point of contact and figure out who else needs to be on board.
Yeah, it's a really good point. We've seen that a few times where the ortho just kind of says, "Oh, you're done."
Yeah.
And they might need pain management or whatever it may be. Let's talk about pain management though. How does pain management interact with what you do, and maybe tell people what pain management is before you answer the question.
Yeah. So pain management, the medical specialty of pain management, has a focus, as you might have guessed, of just getting people out of pain. So the doctors are traditionally, they're physiatrists, which are PM&R doctors, or anesthesiologists. Those those two specialists make up 95, probably 98% of all the pain docs out there. And they'll evaluate you and try to determine your pain generator. That's the structure in your body that's causing you pain. And if possible, then they'll recommend a procedure. It's almost always an injection, at least to start with, an injection to try to reduce that pain. And that's their whole goal, right? They're not going to do an evaluation to try to say, hey, well, how functionally, how's your movement? Can you do a good squat? Can you lunge? What's your range of motion? We'll do pre and post range of motion, or monitor that over the next 2 months. They're just going to say, does this hurt? They'll try to identify the structure that's causing it, and they'll do an injection to make it feel better. And it's a valuable role, because if someone's in severe pain, then sometimes getting that injection will allow them to do the rehab in an office like mine, which will produce the lasting results for them to be able to go back living and doing the things that they wanted to do long term, because the injection is just going to last for a little while. And so you want to have a good pain management doctor that can get the needle to the spot that's hurt if that pain is keeping the person from being able to do what they need to do to get better, or if it's just interfering with their life and they can't sleep. And sometimes things are bad and you just got to get out of pain. And so you do it. So that's the good side. The downside is if you do too much of that, or if the patient says, well, I got this injection and I feel great now, I must be healed. Well, that's going to be trouble, because there's an underlying injury. There's something wrong with that tissue. And though it's been made to feel good by the injection, it hasn't been rehabilitated. So there's still weakness there. In fact, steroids will make the tissue weaker if you do repeated steroid injections. So you have to use that time of post-injection, I feel good, to really hammer on the rehab, the chiropractic, in order to fix the underlying problem, with the hopes that when the injection wears off, the problem has been resolved. Not because of the injection, but because of what you did during the time that the injection bought you.
Very good stuff. All right, so I'm going to pivot over to a couple of questions that we have. One of them is, who are the kinds of clients that should not see a chiropractor? That was texted into us. So who are the kinds of clients that should not see a chiropractor?
Well, I'm assuming this person has in their head, somebody that's in pain. Like I say musculoskeletal, that means like something on your body hurts, right? Like, not to make light of the question, but obviously like a cancer patient, or like, don't come to me because you cancer or a heart problem, or something like that. But for patients that are in pain, off the top of my head, I'm struggling to think of an example of someone that wouldn't benefit, at least from evaluation, to find out if there's something that chiropractic can help them with. And
so there's another question that actually might help you. Just a follow-up question was, what sort of injuries would make a chiropractor hesitate to try to treat a patient?
That helps. So, because the first question was just who shouldn't come in. Well, if you come in, you're going to get evaluated. But then post-evaluation, what kind of patients get sent out immediately without treatment? Something that Tyson, you and I deal with every day are disc herniations. And I have a lot of success treating disc herniations in my office, but there are certain herniations or disc problems, or just spinal stenosis problems, that can cause nerve compression. And there's a big difference between having a disc herniation or a bone spur or a stenotic type problem that's putting pressure on the nerve and causing numbness or tingling, say down your leg from the low back, versus a nerve that's truly compressed. If the nerve is compressed, let's see if I can do something. There's my hand, right? And if this is my nerve and I've got something pressing against it from one side, well, in the neural canal, it might be able to move a little bit. And so chiropractic or decompression care might be able to help to shift things to get that pressure off the nerve, or it might be able to retract what's pushing on it so that there's a lot of space for that nerve. But an MRI might show that if this is the nerve, you've got something pushing on it from all directions and there's no place for that nerve to go. That's nerve compression, and that's straight to the spine surgeon. That person there's no other way but surgery to relieve that compression. So that's, again, you asked at the beginning of this talk about, well, why image, what's your stance on imaging? And that's a perfect example. On physical examination, There's no way for, I don't care how skilled you are at doing a physical exam. I'm good at it. There's plenty of people can be good at it. You can't tell if a nerve is compressed or if there's simply nerve abutment where it's being touched on one side. There's no way to know. So if you were to adjust the patient saying, well, the odds are in my favor that this is just nerve abutment, that's much more common. Well, you're putting that patient at severe risk.
I'm going to ask you a loaded question. It's one of my last questions. What's the difference between a wellness clinic versus an injury clinic versus, well, and what by that I mean like a car accident clinic? You know what I'm talking about?
Sure.
Versus what you do, right? I'm giving you a compliment. You do it the best out of the three. What's the difference? So the wellness clinics, injury clinics, and what you do.
All right. So this term wellness, I mean, what the heck does someone even mean when they say wellness, first of all, because everybody uses it for, I mean, but in chiropractic, usually people are saying I'm a wellness clinic. When you go in and they say, hey, everybody needs chiropractic care. Sorry, I don't know if looks like I'm touching you. Some popped up on my screen. The chiropractor says, hey, everybody needs chiropractic care. Sign up for a lifetime of care. We're going to adjust you, twice a month your whole life. And they have no idea why they're saying this to you. They just say it to everybody. Sign up. We're going to adjust you twice a week. And you've got to do all the nutrition supplements and anything you might associate with wellness. They're going to try to shove down your throat. And everybody has to sign up for long-term care. And it's just crazy. I don't want to disparage people too much, but I think that a lot of people get taken advantage of thinking that they're signing up for something that is really needed and that they have to have. Then you've got injury clinics per se, where all they do is injury, and they're just as guilty of mistreating people, but on the opposite, where you're going to go in and they're going to throw every therapy that they know at you, and everyone's going to get basically run through a mill, if you will. Everybody does this, everybody does this, everybody does that, and you do it for this amount of time, and then you're out the door, and that person hasn't really taken the time to evaluate you and set up a personalized care plan and to have outcome assessment markers to know how well are you progressing through care, so that when the end comes, because there has to be an end to this. And those people the injury clinics just run you through the gauntlet, say, all right, you're done, see you later, that's about all we can get from this lean. And then you're out the door, and you're probably going to have lifetime problems because you were never really treated appropriately. So I try to take a middle of the road approach, where if you have something that's going to require long-term care, we're going to have a long discussion as to why, what it is, what your options are. If you don't want chiropractic care, you're never going to sign up for something long-term. You're just going to choose if you want to do that. But most cases are going to be clearly defined as, this is what's wrong. This is about how long it should take for you to get better. Here's how we'll know that you're better. And then you're done and you're out the door.
Perfect. All right. Last question is, how do people get in touch with you if they want to reach out to you for chiropractic care or have questions?
Well, if you're listening, I'll say the phone number, which is 314-610-3181. But in today's world, almost everything's online. And so Empower Health STL is the website, empowerhealthstl.com. And that's also the Facebook profile as well, Empower Health STL. I've got two. One's Empower Health, one's Empower Health STL, but I keep up with the one that says STL.
Perfect. Great. Kyle, thank you so much for coming on. Appreciate it. If you have any questions for Kyle, make sure you reach out to him. He's a great person, great doctor. I know his brother really well. So great family. So thank you so much for coming on. If you need Kyle's help, reach out to him.
Thanks,
Kyle.
Tyson.
See you, bud.